One of the things that we've really insisted on, again going back to how we make our product, because I feel that's probably one of the biggest parts of the thing that we really do special. It's a very special part of what we do. And one of the things that we insisted on a number of years ago, Robert, was to bring our lab in-house, was to make our own product purely for our own clinics, purely for our own team. And I don't know what your thoughts on this, but I felt that was a big part of the journey for us. It was a big turning point for New Life Teeth, bringing the lab in-house. For us, it just created a real trust and transparency with our patients. We could prove and we could show them that we were using these cutting edge products. We could show that we were producing that their teeth they were produced in a way that was handcrafted, that was bespoke for them. We could iron out any issues with any complications. We could make it seamless for them. And we enthused a group of technicians. We brought them, these brilliant minds, together. And for us, that's been incredible, just watching that journey of the technician side of the business, the technical side of the business, sometimes the forgotten side of the business, sometimes the unsung heroes, we say, where they have to, they're the ones that are, providing all the effort and all the craftsmanship and what our patients love to look at, all this beautiful aesthetics, all this natural formations in their mouths, and they don't seem to get the correct recognition for it. And it's one of the things that I felt was really important for us, not only for the communication with the clinician and the technician. It's so much easier when they're close together, when they're part of one team. You can quite easily each other can communicate quite quickly together to solve any problems. It's different when you're working with commercial labs. You don't get that synchronicity. And when we brought that in-house, it was a big deal for us. Tomorrow we're going to show you, we're going to let you see our new baby.
I look forward to it.
And it's about a lot of pride and joy in pulling this together. And it takes time for a business to do that, but it's been a fundamental change for us, bringing together these experts in one particular area, with all the technology, all this digital technology that's out there, and using these wonderful materials, and encourage them to put their flair on the type of work that they produce, because there's not one set of teeth that fits all. It's not one product that fits all. It's like making a very customized jewellery, I say, and the hours and effort and the craftsmanship that goes into doing this, I think it needs to be recognised, especially with the material zirconia. The more love you put into that product, the more life you get back out of it. And tomorrow, hopefully, you're going to see that. So you're going to see the lab. But do you feel like having that in your business is important, or would you feel if you send stuff out to commercial labs, do you feel it can be enough for you to be successful, and can it be enough for the patient to get a good result?
I think that from a patient point of view, it's an advantage the closer the dentist and the laboratory is working together, because you also know each other much more. Mm-hmm. And if you come to a situation where you want to have a faster and better treatment, it's a very good thing. Where your clinic is very different is that you have a volume that you really can have.
Yes.
A laboratory of your own.
Yes.
Which is a huge advantage.
Yes. Agree.
Because many does not have that. It wouldn't work. But I think it's a really advantage if you have a laboratory that is very close to the clinic, both from not only for the dentist, but for the technician and for the patient in the end, for sure. But I think a huge advantage is that you know the technicians, and the technicians know you. They only work with your team. They know what the team wants, and they can also together work on enhancing the whole process.
Yes.
If you have a laboratory that is distant, usually the clinic is one process and the laboratory is one process. It's not really together. it's in some way you don't get the same relationship for sure.
Certainly, I like that, and it enhances what we do.
No, it does, because you work together in a different way, because you have one integrated process.
But we see that, and
Yeah.
you know, it's been a big milestone for us to do that, and it's something I would never change. I think it's integral to being successful, I think, in delivering the outcome for your patient.
Yeah, and I think especially when it comes to new technology, that you are in sync.
Yes.
Because one thing that I think we all have learned when all the new technology is coming, if the laboratory and the clinic is not in sync, it actually doesn't matter that much what new technology is coming. If you don't have a program that fits with their program and with their material, it doesn't work. So I think that's key. No, I think it's a huge advantage if you have a laboratory, that you work really closely with, and in-house laboratories, of course, the best situation, for
Good.
sure.
No, I'm glad you agree.
No, I do, and I think historically when Professor Brånemark started, he did not have an in-house lab. He had an in-house engineer, but he worked only with one lab.
Yes.
Basically,
Okay.
so it was the same kind of structure,
It's gone full circle.
It's gone full circle.
Yeah.
So that's how it is, and I think that several of the Brånemark Ossetigation centers have their own laboratory.
Yes, I noticed that.
And you noticed that, right?
I think we're all on the same page.
It's in the same, because if you're focusing on, which we do in the Brånemark centers, and say on implant treatment, they do. You all do other kinds of treatment as well, but that is a key part of the patient treatment. You go to a situation where you want to develop that treatment as much as possible, and then the laboratory work is key in the prosthetic work. And as you mentioned, that is not a very well known
Yes.
thing, right?
Yes.
So it's like, but it is a key to get to the excellent result, and then you get closer and closer to the laboratory work. So
No, it's fundamental.
it is fundamental. So and several have an in-house laboratory exactly as you do, because it makes sense.
Well, it's good we're on the same page.
No, but I think also when it comes to delivery of the prosthetics, usually it's faster. If you have certain situations where you need special treatment quickly, you can do that in a different way.
That's right.
Right?
We can.
And these things sometimes happen, unfortunately.
We do take advantage of that sometimes.
Yes, I could
Much to the dismay of the technicians.
I could imagine.
But they get it as well, because they're part of this one team. They feel the need, and they have to go the extra mile.
Yeah.
And you don't get that. I feel it's disjointed if you do it another way.